You might think heartbreak is just an emotion, but what if I told you that sadness can just actually damage your heart, like physically, not metaphorically? I'm going to tell you a real life story from Ukraine about a 63 years old woman from Ivano-Frankivsk who almost died after losing her husband. Hey everyone, I'm Kaushik, final year math student studying right here in Ukraine, and today I want to explain you a condition that's not only rare but also deeply human. You know that it's called Takotsubo Cardiomyopathy, also known as broken heart syndrome. So this isn't a poetic phase, right? It's a real life story, real dangerous heart condition. Let me explain. Just 2 months ago, in my internal medicine rotation, we saw a Ukrainian woman, 63 years old, brought in by ambulance. She had severe chest pain, sweating, nausea, classic sign of heart attack. Her ECG shows ST elevation, troponin were high. And that's when we realized this wasn't just emotional pain. Her heart was literally under attack. What is Takotsubo Cardiomyopathy?
Cardiomyopathy. Broken heart, but doesn't miss.
For Takotsubos include
Takotsubo Cardiomyopathy is just a condition where the heart, especially the apex of the left ventricle, suddenly stops pumping properly due to stress. It looks like a heart attack from the outside, chest pain, ECG change, high troponin. But when you do angiography, the arteries are clear. It's named Takotsubo after a Japanese pot used to trap octopus. But on echo or angiogram, the heart look exactly like that. The balloon out at the bottom, narrow at the top. How does it happen? If we say in simple words, you know how you feel when you get very bad news, like your hands shake, heart race, and you can't breathe. That's adrenaline, your body fight or flight hormone. In Takotsubo, your body release too much of adrenaline suddenly and heart just gets stunned. It's like emotional paralysis. You know, brain sends us signals to adrenal gland, and basically adrenal gland stimulated lots of rushing adrenaline. It causes heart stunning. How do we diagnose it? The diagnosis is a bit tricky because it's really look like a heart attack. So first doctor rule out the clot by doing coronary angiography, and then we do an echo and we see the classic shape. Sometimes cardiac MRI is done to rule out myocarditis, and we look for one important clue: recent stress, death, divorce, financial traumas. And in our patient case, her husband's sudden death was it a very important trigger. Everything else matched. That's how we knew it was Takotsubo. Can it be treated? Yes. Thankfully, Takotsubo is usually reversible. We gave oxygen, beta blockers, and diuretic if there is fluid overload, ACE inhibitors if ejection flow is low, and most important, recover fully within a few weeks. But emotionally recovery takes longer, which is why treating the person, not just the disease, is so important. We often treat medicine like science and protocol, ECG, echo, prescription, discharge, but sometimes healing starts with listening. That day in the ward, we didn't just treat her with meds. We sat with her, we heard her story, and slowly her heart and her will began to recover. Takotsubo teaches something important, that the mind and the heart are deeply connected. Sometimes the heart breaks and the medicine helps to put the pieces back together. If someone around you has gone through a major emotional trauma, check on them. Chest pain after heartbreak might not just be emotional. This is Kaushik, your med buddy in Ukraine, and I will see you in the next story from the world of real medicine. Take care of your heart, both physically and emotionally.